Okay, take two. Thank you everyone for being here for the Patients Over Profits statewide campaign launch, which we are very excited to do with National Nurses United. This is really a National Nurses United campaign, and we are very proud and very excited to be co-launching this with them tonight and all of you. Um, this is recorded and it will be posted to YouTube, so if you want to catch up later or share it with a friend, feel free to do so. And there's lots of really good content, a lot of really educational content on our YouTube channel. Shout out to Thomas, who is here tonight and also one of our top Patients Over Profits pledge getter, but also a prolific YouTube content creator for whole Washington. So check it out. Thank you again for launching this campaign with us. This is a big event, I want to say that. We haven't really launched something new like this for a long time, and we've been doing a lot of work all the time, but there's something really exciting when you can kind of call something a campaign and bring it all together into an organized effort. And so I'm really glad that you're all here because we plan to do all that with you. I also want to thank our sponsors for this event. We often do this sort of work alone, and when I say alone, I mean we are in partnership, but it's done in a sort of loose way. And what's really great about this is we're not only doing this today with National Nurses United, but also with One Payer States and Yakima Valley Healthcare Defense Partnership. So thank you to all the organizations who have helped us do this in one way or another, whether it was a small promotion or a big effort on the event itself. We're very happy to be doing this with you, and we would love to find more ways to do this kind of thing more often. My name is Andre Stackhouse. I'm the Executive Director of Whole Washington. I live in Seattle near Green Lake, and you can email me, andre@wholewashington.org, or use that cal.com link to set up a one-on-one with me, and I'm always excited to continue the conversation and just meet the folks out there who care about this work. Brief introduction to Whole Washington. We are a nonpartisan 501c4 and 501c3 political and charitable nonprofit. We are the largest universal healthcare group in Washington state and authors of a proposal called the Washington Health Trust, which is the only universal healthcare bill in the legislature, but we're also the only group that is actively building a ballot initiative campaign for this in Washington. And we are members of the Healthcare is a Human Right Washington Coalition, and I bring that up because I always like to emphasize that we are part of the universal healthcare movement, and this is universal healthcare movement work that we are doing, and we're doing it with a lot of other groups. And that's one of the great things about the Patients Over Profits campaign. And so we'll be introducing that and National Nurses United soon, but first I want to give a quick moment to give One Payer States the opportunity to introduce themselves because they were one of our partners on this event and helped us promote it and have been doing this work for a long time. And I'm just checking now to see if we have Mike here with us.
Yes, I'm here.
Okay, take it away, Mike.
Thanks, Andre. One Payer States is a nonprofit advocacy network founded in 2009 by single-payer leaders Chuck Pinocchio with the help of Andrea Miller and Donna Smith, who saw states as practical laboratories to prove universal public finance and replace private insurance middlemen with a unified public payer that treats healthcare as a human necessity and a foundation for national security. Notice I avoid stating human right because that doesn't sell east of our Cascades. Over time, it formalized as a 501c4 political advocacy organization with an all-volunteer board, grassroots fundraising, and membership support to work directly on campaigns and legislation such as the state-based Universal Healthcare Act, drawing on Canada's province's first path to national coverage. OPS organizes and connects state campaigns, educates activists and lawmakers, and advances single-payer, publicly funded, privately delivered reforms that cut wasteful billing and redirect money from administration and profit into clinical care. It backs single-payer, unified financing that guarantees comprehensive universal coverage, medical, mental, dental, vision, and long-term care without premiums, copays, or deductibles. So care is based on need, not the ability to pay. OPS supports the Patients Over Profits frame because both insist on a publicly financed nonprofit system that puts people before corporate interests and demands high quality, cost effective healthcare for all.
Thank you very much, Mike. And I just have to add that One Pair of States has been one of the best national strategic partners for whole Washington. We very much believe that universal health care is not the responsibility of one jurisdiction, but instead a commitment that needs to be um, reinforced at every level of government. So we're talking local, county, state, federal. This is a job for the entire government, for our entire society to come together and make happen. And One Pair of States understands that quite strongly. And we are delighted to partner with them on this campaign launch, this campaign, and the universal healthcare movement broadly. And with that, it is my very, very exciting honor to introduce National Nurses United. And I will leave that mostly to Riley, who can, I think, give them a proper introduction. But I will just start by saying that National Nurses United is the largest nurses union in the United States, and they are made of exactly the right kind of stuff to win universal health care. They are radical, they are unapologetic, they take it, like I said, from local, county, state, and federal. They are always finding a way to move this issue forward. And they are the organization that created the Patients Over Profits campaign, which I think is one of the most powerful tools in the universal healthcare movement's toolbox. And so with that, I am very happy to hand the presentation off to Riley to explain more.
Coolio. Thank you so much, Andre. And yeah, really good to continue to get to work with you over the years on this. I've known Andre for a while, and yeah, and good. And then there's also many other folks I see on this whole Washington call that I've worked with over the years. So good to see you all as well. But yeah, my name is Riley Brand K. I am an organizer with the National Nurses United. I use he/him pronouns. I'm calling in from Alone Land in Vallejo, California, where I work for NNU. And yeah, I would love to give a brief overview of the Patients Over Profits campaign, how it started. I was actually in the room when it started, so I was part of those meetings, and it's one of my like most proud accomplishments in my like organizing yeah career. And so I'd love to talk about the accomplishments that we've done and where we plan to go next with it. Really quickly for folks, if you aren't familiar with National Nurses United, we are the largest union of registered nurses in the country, representing over 225,000 bedside nurses. And we have been fighting tirelessly for Medicare for All because nurses see the effects of our broken healthcare system every day, right? As patients ration or skip care simply due to cost. At National Nurses United, we know that Medicare for All is the solution and the only solution that we need to fix this country's healthcare crisis. And we also know that if we're going to win such a bold reform, it's critical that we reduce the influence of the corporate healthcare industry on our political process, right? They have a chokehold over our democracy, if you will. And that's why our organization, along with dozens of other organizations, including Whole Washington, yeah, work on and created the Patients Over Profits Pledge. In a moment, we'll discuss exactly what the pledge is and why we think it's such an important tool for winning Medicare for all. But really quickly about just on slide 2, the nurses and Medicare for all. So I'm sure I don't need to tell you all that our current system is not just broken, it is failing, right? Under the weight of corporate greed and Republican attacks. We desperately need to pass legislation to enact Medicare for all. That is why our union works to build support for Medicare for all in Washington, D.C., by engaging directly with politicians, but also organizing across the country so that people can make their voices heard and demand action from their legislators. But despite having support across the country for Medicare for All and across the political spectrum, right, and it's both support on blue and red, we do not yet have the support on either side of the aisle in Congress because we are not the only the only ones speaking to these politicians, right, i.e. the lobbyists. So the industry is spending more on lobbying than on any other industry, or sorry, the industry that spends the more money on lobbying than any other in our country is the pharmaceutical industry. The second highest spender is the insurance industry. And just a few places behind that is the hospital industry. So take a look. Moving on to slide 3, a look at this political article from just a couple months ago. And the first 3 months of the year alone, AHIP, the largest health insurance lobby group in the country, spent more than 5.3 million in lobbying on Capitol Hill. The pharma lobby, they spent 12.2 million, and the American Medical Association, or the AMA, they spent $8 million. So that's a combined $25 million from the corporate healthcare industry in just 3 months, right? So they are quite literally just taking a chunk of all of their profits every quarter and funneling it into lobbying. We'll never be able to compete with that kind of money, which is why we need to toxify it. Right. And it's not just through lobbying that healthcare corporations try to help shape healthcare policy, right? They also do it by spending an incredible amount on political campaigns themselves, both directly to elected officials and through independent expenditures to influence elections. In 2025, the top 50 corporate PACs with the most combined contributions to candidates included Anthem, or Blue Cross Blue Shield, Cigna, and Eli Lilly. So I got an article that I'm going to go ahead and just drop in the chat for people so that folks can take a peek at this Politico article. But yeah, these corporations are obviously a major barrier to us winning and enacting Medicare for all. This is why developing a strategy to work to reduce their power and their influence over our political spectrum is so important. So the Patients Over Profits campaign is already nationally supported by individuals and organizations alike, right? So NNU, Whole Washington, Healthcare Now, People's Action, Medicare for All Florida, and Popular Democracy are just a few of the national and statewide organizations that are using the POP pledge to call upon their local, state, and federal candidates to stand with patients over corporate profits. The Patients Over Profits, or the POP pledge, as we endearingly call it, seeks to drive a wedge between the healthcare industry and our elected officials, right? We want them to choose a side. We want to isolate and toxify the corporate healthcare lobbyists, and candidates should avoid them and instead do the work to earn community support. The Patients Over Profits pledge calls on politicians at all levels of government, right, to reject campaign contributions from the executives, lobbyists, and PACs affiliated with the corporate healthcare industry who are scheming to further take over our healthcare system and our democratic process. The pledge literally takes our fight directly to the for-profit healthcare industry and goes after the direct financial ties to our elected officials. And I want to emphasize the point that we are growing this, right, by going after people at all levels of government, right? Whether it's local city council, any kind of teacher board, anything that is an elected position, is they're eligible to become a Patients Over Profits pledge signer. And it's because we want to build up the reputation of the pledge. Moving on to slide 5, as you can see on the slide, or sorry, I'm kind of trying to follow along with the slides. You might already be there. Oh, yes, you are. Okay. You can see the slide and the pledge, how it reads. So I pledge to put patients over profits and not take contributions over $200 from the executives, lobbyists, and PACs affiliated with the corporate healthcare industry, including private insurers, pharma corporations, and private hospitals who are organizing to take over our healthcare system. This simple yet powerful statement is modeled on the No Fossil Fuel Money Pledge, which has been largely successful and has received thousands of signers, including many major candidates for president. We aim to make the Patients Over Profits pledge just as much of a litmus test for any Democrat or left candidate running for office. And the good news is our momentum is growing exponentially. Across the country, people like you on this call, other activists, other healthcare organizing groups are reaching out to politicians to ask them to sign the pledge. And organizations like Whole Washington are officially adopting the POP pledge as one of their organizing tools and endorsement tools, as I understand. So we've had some incredible successes, and I want to share a few of those with you tonight. I'm actually going to just try to take over the screen if I can. Okay. So yeah, this is our website. You can see just patientsoverprofits.org. We'll put that in the chat for you all. There's a link for politicians to just take the pledge themselves and get the printable little sheet that they need. And yeah, we have some information about the pledge. We also have, I went ahead and updated the signees page for today's call. So you can see these are all of the recent signers. We even got a few notable ones today who I think actually directly came from the work of you all with Whole Washington. I know that Andre has been sending us in some signers. So some of these Washington ones that you'll see are from him and from others within Whole Washington. But yeah, these are some more recent, newer ones. And yeah, because of the work of literally folks on this call, right? We have candidates and incumbents, I should say, running for office who are posting about the pledge. We get at least 10 of these posts a week. It has been growing and growing and growing. And so yeah, I just really deeply wanted to say thank you to all of the people who've been working on the Pop Pledge with Whole Washington. As you guys have been doing tremendous work. And yeah, we have seen candidates sign from all different levels. If you're able to bring the slides back up, we have a slide where we have some of our most notable signers recently. And yeah, this is all thanks to some hard work to folks like all of you. Perfect. Thank you so much. So yeah, you can see that folks like New York Mayor Zoran Mamdani signed the pledge. He actually signed the pledge months before he was in the news and months before his campaign took off. It was way back in February before the primaries even. And so yeah, he just was asked by, I think it was a New York City DSA volunteer, and then signed the pledge. You can also see on here, there's Jill Stein, who was asked by Green Party members who adopted the pledge in New Jersey. Folks in Maine got Graham Plattner to sign. We also got Randy Villegas in California to sign, who is, if you follow California politics, he's going to flip a historically red district blue and potentially win us another Democratic seat in Congress. And so, yeah, there's really amazing candidates. Another one recently was Julia Salazar, who's a sitting state senator from New York. These politicians are winning elections and gaining support from constituents by standing with patients rather than the corporate healthcare industry, unlike some of their opponents, right? So we know this means that we will soon have many more strong advocates for Medicare for all and for the people in positions of power across the country. And that's our goal, right? Get these younger, newer politicians who are gaining steam to adopt the pledge, and then it becomes the sort of golden standard. And so, yeah, again, I want to thank all of the folks on this call who've been doing amazing work. This campaign is powered by volunteers, ordinary people all over the country who are dedicated to healthcare justice and who recognize the need to drive a wedge between the industry and the politicians who are meant to represent us. And yeah, folks on this call have been doing tremendous work, and I look forward to getting to work with many more of you as we move closer to the midterms. Every candidate, right, that we can think of should be asked to sign this pledge. The most straightforward way to ask a politician to sign the pledge is by using our outreach list to email candidates. I'll put the link in the chat in just a moment, but this is a list of candidates and elected officials from across the country that we think would be likely to sign the pledge if they were to just hear about it, right? I'll put that link in the chat again for you. Let me see, right now. But yeah, this is our sort of working outreach list. It gets updated by our research team and by our team. The outreach list also includes other forms of contact, such as phone numbers, social media accounts, and websites. If you don't get a response to your email, you can also try reaching out another way, right? And yeah, the list was developed by our amazing volunteer research team. The research team is a small but mighty group of dedicated supporters who do research on their own time from the comfort of their own home or when they're ready. And they power the larger work on the Patients Over Profits campaign by finding the most likely progressive politicians across the country, as well as their contact information. And then also lately, they've been researching events for people to go to. And then, yeah, this enables volunteers to either go to those events and ask these politicians in person or to contact them, electronically to ask them to sign the pledge. If you're interested in signing up or learning more about any of our volunteer teams, I will also put the little form in the chat. But yeah, our research team also powers another important part of our work by looking up these in-person events where multiple candidates will be attending. Volunteers then attend these events and ask all the candidates who are there to sign the pledge. It's a really, really super effective way to get a big handful of signers in one go. Our volunteers in Virginia, California, and other states have successfully attended some of the events that our research team has identified. And then, yeah, at one recent event, a volunteer in Virginia secured 5 new pop signers at that event. And 5 new signatures means that there are 5 new candidates who are not for the for-profit healthcare industry, and they stand with patients over profits. And in California, one of our long-term volunteers was able to get 3 new signers at a recent event as well. So I encourage everyone here to attend events like this if possible, right? And go to where candidates are doing, forums or whatever to ask them to sign the pledge. This is an easy thing for really anyone to do. Really, all you got to do is keep an eye out for events in your area, print out some copies of the pledge to take with you, and which you can find on our website, and then go to the event, right? And then just ask them to sign, give them a pen if they're ready to do it right there, take a photo of them so that it gets recorded. And then, yeah, that's pretty much the nuts and bolts of how this works. We also have an in-person events guide if anyone is interested in looking at that. But yeah, so thank you to everyone who's taken time, to be a part of these teams and a part of this work. And if you haven't been involved yet, I'm glad you're here tonight to get started. So as you can see, the POP campaign is really popping. We are getting tons and tons of new signers. We just hit a milestone of, I think, 545. We're almost to 550. We were just at 500 like barely 2 weeks ago. So, we're really excited to keep the momentum of this going. This campaign does really kind of like fire up during the midterms and during election cycles, right? When all these candidates are out looking to get, sign a pledge or try to distinguish themselves from another candidate. And yeah, so we believe now is really the moment to push even harder, and we're so thrilled to be working with all of you at Whole Washington to do just that. We know people are super busy. We know that there are a lot of important political struggles going on at the same time, and we are sure that people on this call are already involved in many of those struggles and other areas of social justice. So thank you for that work as well. We want to take a moment to explain why this is a moment when the POP campaign deserves attention and action, though. So we have an opportunity to boost the impact of this campaign. We are in the midst of the primaries and we are running up into the midterms, right? So we know that candidates are more likely to sign when they're competing for our votes. And that's why it's imperative that we take this opportunity to challenge politicians and make sure that they show which side they're really on. POP is also a way to keep healthcare in the political conversation, right? Trump thrives on sowing chaos and destruction. So many of his terrible and the Republican actions is about diverting our attention away from things that will actually make a material difference in people's lives. So that, his goal is to make sure the rich get richer and that the chaos ensues for the rest of us. One of the things he is trying to distract us from is the healthcare crisis, right? And the ways in which he is making it worse. HR1, we don't need to talk about but we all know it was a disastrous bill for healthcare. It absolutely obliterated our Medicare, Medicaid programs across the country. And yeah, so, to put simply, if we can make healthcare a major issue in the midterms, Republicans will lose seats, and the balance of power will shift. POP is one of the ways that to help ensure that, yeah, we can push back against those that would wish to dismantle our democracy. This is precisely why we created the Patients Over Profits campaign, right? To push back against capitalism's encroachment on the people. We believe that it is necessary to reduce the amount of power that these gigantic healthcare corporations have on our government if we want to win transformational changes to our broken healthcare system, like Medicare for All, right? And we believe that reduction happens when regular people make it clear to candidates and elected officials alike that they won't back down until we get the healthcare that we deserve. We must keep agitating against the profiteering of the corporate healthcare industry and the laundering of profits to politicians via campaign donations and so much more, right? That's why a major focus of our work for the POP campaign is to continue building the momentum behind the popular demand that candidates and elected officials who want to stand with the people must publicly pledge to cut those campaign ties with the for-profit healthcare industry. So yeah, we look forward to working with all of you to do just that. I'm going to go ahead and pass it back to Andre. That was the end of my sort of presentation, but I encourage everyone to check out our website and to learn more about the pledge and the current list of signers. I'm also happy to take questions for a little bit if necessary or folks would like, but I'm sure you also have other things to get to in your agenda. So yeah.
Thank you so much, Riley. We'll pause briefly for questions here. Go ahead, Thomas.
Yeah, I'm just talking or saying out loud a question in the chat. How do we hold them accountable when they sign? And uh, yeah, that's mostly the question. You're on
Do you want
silent.
to take it?
Sorry, everybody. That's a great question. It's been coming up actually more and more as we've been, growing the pledge. And when, like let's say someone signs and then they rerun for office again for a higher spot. That's absolutely happened as well. And so, yeah, one of the ways in which we do that is just by like checking the campaign finance reports on these folks. That's something that we're like actually now gearing up to train the research team to do periodically, going back and going through them. We also track like whether or not they won their primary, if they're candidates, if they're incumbents, if they're already elected to office. But yeah, and then if we find out that there's a violation happening, which we've came close to a few times, then we would rescind their pledge verification. And we haven't had to do that for anyone yet. However, we're considering, doing that if necessary. Well, we'll do it if necessary, but considering making like a separate page that is like, oh, these are the Patients Over Profits, like pledge failures or something like that. The No Fossil Fuel Money Pledge does have a page for people who have signed and then rescinded or gone back on their pledge. So we are definitely considering doing that once we get there.
Go ahead, Jason.
I was wondering if a candidate happened to have taken, maybe they didn't realize it or whatever because, you get lots of donations. Is it possible to, what's the line? If they've already gotten some, then they can't sign, or do they give everything back, or what?
So anyone can sign. And yeah, what we consider, and this is the same thing that the No Fossil Fuel Money Pledge does, is from the date that they became a signer, right? And so we're not going to go back through like years or even really months of someone's donations. We consider it from the time that they are a signer, because before then they did not sign the pledge, right? And so from the time that they sign the pledge moving forward, that is when we consider them an active pledge signer. So candidates candidates, like it has come up that like candidates have received money like a year or two ago and then have, turned a leaf and signed the pledge. And so we will continue to watch those ones specifically that we are aware of their donations in the past before they signed. There are a few. And so, yeah, if we find out that those folks have, actually in turn taken money, which is, we've realized that this is actually is a lot of work, which is why we're gonna like train our volunteer teams to do this as well. Because think, you're talking about lobbyists. These folks are sometimes individual names. You have to go look at who they work for, et cetera, et cetera. So there's a bit of digging and uncovering that goes with that. But to be quite frank, it hasn't really come up. It's come up way less than like the very positive aspect of this, which is signers who have signed and then come back to us and re-signed when they've like gone, to their next election. Tons and tons of folks have been, yeah, growing. Like, the exponential growth is just incredible from, the Zoom meeting that we did in 2021 about this to now. But yeah, happy to answer more questions about that.
Okay, we'll go with Matt, and then that'll be the last question for now. We'll have more time later.
Hey, so obviously healthcare is a hot button issue for everyone right now, especially for Democrats. And I'm just starting to see a lot of kind of squirrely messaging, kind of ways that people are starting to thread the needle with, quote unquote healthcare solutions because they know they have to offer some kind of solution. They know they have to say that they want to address healthcare in some way. I'm just curious if as part of your watching of lobbying organizations and things like that, if you're starting to see that stuff as well, and if there are things that you would advise us to watch out for.
Yeah, that's a great question, Matt, and I'd love to answer it. 100%, absolutely. We're seeing proponents of, and this is exactly what is happening, right? Like industry knows this is inevitable. They see the writing on the wall, right? And so they're doing everything in their power to hold on to their profits. And the way they're doing that is funneling more money into these think tanks, into these politicians, saying that we have to come up with these solutions, that are going to fix this or that, or they try to, come up with piecemeal solutions. At this very same time, and especially during elections, we see, organizations that are asking politicians to like settle for a public option or something like that. That's been a huge thing in the last like few months is that, we've been pushing back against politicians who are like trying to bring up the public option as a way to get towards Medicare for all. And so as we get closer and closer to winning and enacting Medicare for all, and either at a state level or at the federal level, and in any of these states, we're going to see proponents of piecemeal measures become more and more popular, and at least in the sense of like the media will elevate them and try to make that seem like these are real serious, healthcare reform ideas when there's not a movement anywhere in this country for a public option. No one's gone out and had a protest to try to get a public option or to go to their, legislator to demand a public option. The people want and are demanding Medicare for all and nothing less. And so, I would say that as we get closer to the midterms, we have seen, more money being spent and from that direction. Hope that's helpful in answering your question.
Thank you so much. And we're going to have to move on, and we may have to keep the pace up a little bit. But I just want to thank Riley and NNU so much for joining us for this and for breaking it down like that. You're the best people for the job. So thank you very much. And I had a slide for that too. Okay, so I want to jump into the Washington state side of this. I'll try to move relatively quickly, but I think, some people may be wondering what exactly do we mean by a campaign launch? After all, this was launched in 2020. The first signee from Washington state was in 2022. So here's our answer to that. And I think that Riley helped us see this a little bit. So if you look at the growth of the Patients Over Profits campaign, you'll see that in that first year, it only got one pledge, only 6 in the second year, hits 2 digits by 2022. That's when Washington State comes on board. And we see that it's really grown a lot over the years, and it's grown quite a bit in Washington. And I want to say that there have been people, National Nurses United has a presence in Washington. There are people who pay attention to these things and have found this campaign and have supported it and have helped move it forward. But really, many of the pledges that have come in Washington have been from candidates who took their own initiative. They may have been asked in the last year for the first time. Many of them may have been asked by the same, just small handful of people. And so this is what we have achieved without any sort of particularly organized or sustained effort around it. So my question for everyone here today, and we still have people joining the call, I think we're at 74 right now, is how much bigger can this get when we launch this as a campaign? How much bigger can this get if we send even just one email to our list of over 12,000 recipients? These are all things that we have yet to do, and I think that it shows how much farther we can take this. And I will just point out that primary elections are coming up on August 4th, and it's not a coincidence that we are launching this campaign now because the medal is hottest right now. So we can get plenty more of these pledges even just in the next month. So part of what we're launching today is wholewashington.org/patientsoverprofits. And this is basically going to be our campaign's Washington-focused homepage. So of course, this is still a National Nurses United campaign, but what we are able to do on our own website is create a set of actions and create a set of trackers and all of those tools that are very focused on Washington State. And so this is going to help us get organized here. This is where we can document our signees. This is where we can create very specific asks on how to take action and who we're targeting and what the next steps are. So I really say that this campaign is just getting started. And I do encourage folks now, if you have a moment, to go ahead and open wholewashington.org/patientsoverprofits. You can use that QR code there. And if somebody, Thomas, if you would drop the link in the chat to make it a little easier for folks, that would be fantastic. Some of what we're going to go through next, we'll go over content on that page. So feel free to just have it open, take a look at what's there, and then we'll be jumping back to it across the rest of the time we have. As we do that, and one thing you'll see on the page is that there is a list of signees based out of Washington, so you don't have to scroll through an entire national list. You can just go straight to who in my community has taken this pledge. And with the time we have, we might have to move relatively quickly, but folks, use the hand raise function if you are one of the signees of the pledge here with us tonight. I'm seeing hands come up, and I, in fact, am looking for my own hand raise function, which maybe I can't do because I'm sharing screen, but folks who read their ballot carefully may remember that I ran once and took this pledge. And I'm seeing 1, 2, 3, 4, 5, 6 at least coming up right now. So I think we can give folks about a minute each, but I'm going to just go through in a sort of grouped order, starting with current office holders. And I know that there was already one who unfortunately is not listed here because of that last batch just coming in today. Didn't quite make it onto the slide, but for everyone who, and by the way, I want to apologize at the outset if there are any other errors or inaccuracies. It can sometimes be difficult to tell who currently holds office versus a candidate because sometimes a current office holder is also a candidate. But I want to start with anyone who is a current office holder at the local or state level. Please, we'll try to be somewhat civilized about it. But if you could just briefly come off mute, introduce yourself, 1 minute or so about why you took the pledge and what it means to you, that would be fantastic. Do we have any folks here? I know we got some. Go ahead.
I guess I
Go
can
ahead, Kevin.
first.
Yes, please.
Good evening, everybody. Thank you to the whole team at Whole Washington and the incredible members of the National Nurses United for having me tonight, and more importantly, for organizing this vital campaign. My name is Kevin Moynihan. I'm an Aberdeen City Council member, a proud commercial line cook, and I'm running to be the next state representative for Washington's 19th legislative district. I took the Patients Over Profits pledge because for me, this isn't an abstract policy debate. It's a daily reminder for me, as well as the families I live next to and serve. Out here in Southwest Washington, our rural communities are trapped in massive healthcare deserts. We're watching local clinics close, families rationing life saving medication because of skyrocketing costs, and working parents being forced to drive an hour or more just to see a specialist or access basic care. When corporate healthcare monopolies and insurance giants pour millions of dollars into political campaigns, they aren't doing it out of the kindness of their hearts. They're buying outcomes. They are buying the status quo that keeps their profit margins high while rural neighbors foot the bill and exhaust their life savings just to stay alive. As a campaign that refuses 100% of corporate PAC money, taking this pledge was a no-brainer. I believe an elected official should answer only to their neighbors, not to pharmaceutical lobbyists or insurance executives. Our nurses on the front lines know exactly what our healthcare system looks like when it's driven by a balance sheet instead of a human dignity. We need systematic change in Olympia, and that starts with electing leaders who have the backbone to say no to corporate cash and yes to healthcare as a fundamental human right. I'm honored to stand shoulder to shoulder with whole Washington and National Nurses United to build a system that finally puts people, patients, and healthcare workers over corporate profits. Thank you and solidarity.
Thank you very much, Kevin. Do we have any other current office holders with us tonight? I believe not. So I just want to say, from local and county and state office, we already have a pretty wonderful and powerful group of pledgees, including a mayor of Seattle who won a quite historic election, 3 state legislators, a bunch of city council members running for higher office, Teresa Mosqueda of the King County Council, pretty well known in this space. So we're really glad to see this. Moving on to current federal office holders. Unfortunately, we do not yet have any members of the Washington state delegation who have taken this pledge. Maybe they haven't heard from us yet. Maybe they haven't heard from enough constituents yet, but we think that they will be soon. And now is a really good time to make the ask. So moving on from there. Current candidates for office, and I know we got a few here today, and please, I am sorry to cut you all short, but if we can just keep it to about 1 minute or less, we got a little bit more content to get through, but I would love to just go down the line, starting with Catherine.
Yeah, thanks, Andre. I would like to really quickly maybe address Aruna's second question. But my name is Catherine Lewandowski, and I'm running, I see it says for LD 38. I'm actually running in the 39th LD, which is a very red conservative district here up about an hour north of Seattle. For state rep, position number 1. And Aruna asked, how do we convince candidates who choose not to? I have always been a supporter of the POT Pledge and of National Nurses United. I've done organized barnstorms with them and such, and I think they are so wonderful. But the person who's running for the other position, this time position 2 in LD 39, I had a conversation with her. She wanted to know more about whole Washington, and she had concerns about taking the pledge. We are running against her position is kind of open because the Republican one Republican retired, but the ones that the one they endorsed and the one I'm competing against are both being funded by millionaires. And she was concerned that she would not be able to raise enough money to be successful in her campaign if she takes the Patients Over Profits pledge. So how do we combat that? And I think it's really important that we try to combat that. And I think the best thing that you can do is, 1, to send emails, to call up your candidates, ask them if they'll take the pledge. If they say they don't think that they can, explain to them. Hopefully, you've got a good healthcare story that you can share with them to explain the importance of them. And then also, I think it's important to make a donation to their campaign because they don't have the ability to raise as much funds. We don't have any millionaires supporting us. Um, so, and then it's important for you to make a donation and then share it with all the people that you know in those in your districts so that they can collect, bring in enough
Catherine,
money to run an
I'm
effective
sorry.
campaign.
We have
So,
7 minutes left. I really
okay,
need to keep it moving.
sorry. All right.
Thank you.
Thanks.
Up next, go ahead, Dusty. You still on mute?
Child, that was a beginner's mistake. I am so sorry. Hey there, I'm Dusty Gareb. I am running for Clark County Council District 1 here in Vancouver, Washington. And signing this pledge was an absolute no-brainer for me. I come from a poor family and one that struggles with a lot of chronic health issues. This issue impacts my family directly, in particular, my grandmother. And, we would love to just take better care of her without having to worry about, collectively paying it with between me and all the other grandkids. So you're doing really important work, and I'm just really grateful to be here. Thank you.
Thank you so much. Was it Vancouver City Council, you said?
Clark County Council.
Clark County Council. I don't know how I missed that one. Up next, go ahead, John.
Thank you for the opportunity. I'm John Dresky. I'm running for Congress here in Central Washington. That's CD4. And like Dusty just said, this is a no-brainer. I'm a TRICARE for life kind of guy. And so I kind of know somewhat what this would look like from the inside. But more to the point for all of you, I've been up and down this district. I've talked to hospital administrators. I just talked to a doctor today, and he basically said everything is bad. Like the whole system is collapsing, and we've got to do something more different. The last thing I'll say about this is there's a famous quote about America will do the right thing after exhausting all other possibilities. And I think that's particularly apropos here. It's just past time. And I'm running in a red district, but this district's 55% on Medicare and Medicaid. Fixing this is not an option. Thanks, guys, for the work you're doing.
Thank you very much. Go ahead, Alex.
Hey, can you see me?
I hope so. I'm sharing
so.
my screen.
Yeah. All right. I'm out in Ocean Shores, so my stuff's kind of spotty. I'm Alex Scheel. I'm running for the Washington's 10th Congressional District. I'm a Democratic Socialist and combat veteran. I'm running to end the wars in Iran and the genocide in Palestine and use that money, that billions of dollars you're spending every day on Medicare for all, housing, and the affordability crisis. I'm so proud to sign this pledge. Such an important thing to me is, we've all been affected by the opioid crisis in our lives. I've lost a lot of people to opioids, including my sister, who it just so happens yesterday was the 10th anniversary of her death. And I think that if we had universal health care, she'd still be alive. I take my health care from the Veterans Affairs, and that's under attack by the Trump administration. They're privatizing everything they can get their mitts on. If we had universal health care, that wouldn't be an issue. My wife, Julia, who I think is on this call, is a nurse. I hear every day about what nurses and doctors and healthcare professionals are dealing with. Whole Washington is on the forefront of fighting for universal health care and Medicare for all. I think this is a great thing. Thank you so much for being here. We're trying to make the world a better place, and what you're doing is important. Thanks to Andre and everyone else for having me. Have a great night.
Thank you so much, Alex. And I know I saw Melissa Chowdhury here. Did you, your hand's not up, but I assume you want to as well, right? Go ahead.
Hi, thanks so much, everyone. This is a deeply personal issue to me. I grew up inside the military healthcare system. My father was a Navy commander, and he was a physician. And he told me he could not imagine having to evaluate whether his patient could pay money before treating them. This is the most basic human dignity issue there is. I believe that healthcare is infrastructure. Healthcare is the baseline from which a healthy society can grow. And I look forward to being hopefully among your first in federal office from Washington State who has taken this pledge, who will uphold this, who will make sure that we, the people, are not subsidizing parasites, because that's what's really going on here. These health insurance companies are not adding anything to the equation. We are paying about 40% more than we would to cover everyone, just so that they can take home billions of dollars and add layers of complexity that make everybody's lives worse and cause us tens of thousands of unnecessary deaths a year, plus the unimaginably high number of wasted hours. Okay, so I look forward hopefully to working with Alex and working with the other folks who are on here in the federal level, including ending those wars and bring that money home and making sure we're taking care of the American people in a very inclusive and supportive way. Thank you so much.
Thank you.
Oh, and I'm running in the 9th district. Thank you. South King County.
Thank you. Okay. And then we also have former candidates and office holders, and I don't know if any of these folks are here tonight. I see Leah was here. Did you want to briefly speak, Leah?
Sure. So yeah, I signed it because healthcare is a human right. I've actually been working on Whole Washington since 2017 when it started, and I definitely support this. I think all of our candidates should be supporting us. And my story is my husband had a heart attack 7 years ago, and we were $130,000 in debt and we had ACA. So we definitely need to get this taken care of. And thank you for your time.
Thank you very much. Okay, I'm going to move on. I know, so we're at 7, which means that this will just go a little bit beyond, and I understand if anyone needs to drop, but if you'll give me just a little bit longer, I don't want to cut this short without the action portion. So thank you everyone for being here. And I'm going to try to run through these relatively. We're not going to have as much time for these as I would have liked, and that's unfortunate. But we have all the time in the world because this pledge is ongoing. Okay, so the first thing I want folks to do, and you can kind of get started and finish this over the next couple days if necessary. But the first thing is, if you get a piece of paper or a digital note-taking app, what I'd like you to do is to write down your federal reps, your state reps, and your city council members. And it's not going to be that huge a number. You have 2 senators in Congress, you have 1 representative, you have 3 state legislators. I threw in the governor, and then you should have, I think city councils might do it a little differently, but if you write down anyone who represents a district, as well as any at-large members, and then your mayor, you should have a nice little list of somewhere between, 8 to 12 people or so. So go ahead and start working on this list. And then what I want you to do next is to go to the Patients Over Profits page, the whole Washington State Patients Over Profits page, scroll to the section that says who's taken the pledge. And what you can do is you can check off any people who are on your list who've taken the pledge already. And then last but not least, and this is the one if you have even just a minute to do right now, this is the one I'd like you to do, is to make the ask. So what we have, again, on the Patients Over Profits page, and I'll show this on the website, if you go to the section that says Activists, How to Help, and you use the form that says Contact Your Legislators, what that's going to do is it's going to automatically target your state and federal legislators and make this ask. And what's great about it is if they've already taken the pledge, they'll be left out. So it does the targeting automatically, it knows who's taken the pledge, and it will send off a pre-written message, or you can customize it. And so once you do that, you can go back to your list, you can check off all of your federal representatives and your state representatives, but not the governor, because it only targets the legislature. And then last but not least is I'm going to ask for some follow through. So you can make the ask today by sending an email. Like I said, that online form, it only does your state and federal representatives. So there's also a link that you can send to all of your local and county representatives. And you can say, here's a link, just fill out the form, and you can take the pledge on your own time. It really only takes them a couple minutes. Once you've gotten that ask out there, now you're in the realm of following up. So give them a day, give them 2 days, give them a week, whatever feels right. But follow up with them by calling their office. Say that you know that you sent them the pledge. Have they had a chance to look at it yet? Feel free to talk about it with their staffer if that's all you're able to speak with. And then you can print out that paper pledge, and you can walk up to them and ask them in person if you're still not hearing back after several attempts to reach them by email or phone. Last is you can join our legislative advocacy team, which meets Thursdays at 11 a.m. weekly. And this is where the Patients Over Profits campaign lives in whole Washington land. And so that's where you can get involved with not only that, but the rest of our legislative work. And then this is a great campaign to bring to your organizing community. So if you're with a DSA or an Indivisible or any other organization that does this kind of mass mobilization, this is a really easy one to bring them. It's really just a couple links that are pretty self-explanatory, and the rest happens pretty much on its own. So that's really all there is to it. I said thank you for joining, and we can leave a little bit of time. But before we do that, I did just want to quickly show you that page for folks who haven't seen it yet. So the Patients Over Profits page, this is whole Washington's. You can see that this section here has the full pledge with a link to that online form for the candidate or elected official to take the pledge. If you go down here, here is the action. I'm going to put this in the chat and say, please take this online action now. Oh, there we go. There's the link in the chat. If you need the paper form, you can get a copy here. Here's an example of how to send in the verification photo. And then here's that link that you can send to local and county candidates. There's the list of signees, and there's the link out to National Nurses United and the National Patients Over Profits campaign. So it's everything you need right here. So thank you very much again, and I'm happy to stay on for a little bit longer if there are any additional questions. Why are some of the entries on the tracker sheet highlighted? I'm not sure. You might be looking at a different one than me. I haven't looked at National Nurses United, their tracker sheet, so it might mean something to them. Thank you, Melissa. Thank you for joining. I will go ahead and open this link, and we can take a quick look. Yes, so this is NNU's tracker. I don't know what the highlighting means, but I definitely encourage folks to use this so that we can keep our data and our outreach as coordinated as possible. J.R. Woods, go ahead. Question?
Hi, yes, Andre, I wonder if you've had any luck at all getting together with our Indivisible Bellingham people. They've usually they're booked up pretty good with their monthly meetings, but I think a slideshow or something and including this also would be a good talk at one of the meetings.